Marin with Kate. Actually, Claire, then I went to Mayo Marin. And now look at, I'm following her here. I copied Kate.
Scoot your butt that way.
Is it okay?
Yeah.
Are we in?
Are you recording?
Yep.
Okay.
Oh, no. I need a list. Because I don't know what I'm going to say.
I love the maroon pants.
I don't have maroon tops, so maroon pants it is.
Oh.
Yeah, it's cute.
Okay, good morning for our 4th episode of Coffee at the Clinic.
I think so.
The 1st of January of 2022 and the first with the completed Sensible Solutions Care Clinic team. Cheers and good morning to the team. Thank you all for joining us. I'm Jamie Edwards, nurse practitioner and owner of Sensible Solutions Care Clinic. And I am going to introduce you to my amazing team. If you already know us, thank you. Caitlin Sloan, nurse practitioner. Brooke Shatley has been our everything chick, certified phlebotomist and provider assistant, and you name it, she does it. And I'm going to also introduce to you Jolene Thalacker and Hannah Thalacker. Weird, right? And before we jump into the topics for today, I'm just going to have them introduce themselves to you.
Hi, I am Jolene Thalacker, and I am an administrative assistant here at the clinic, and I will be at the front desk.
I'm Hannah Thalacker. I've been a registered nurse for almost 10 years. I have experience in hospital nursing as well as clinic nursing with mental health and public health, and I look forward to joining SSCC clinic nursing to my resume.
And we're just a little excited to have the team completed. So, if you don't know, we are a direct primary care clinic. We do not work with insurance companies for payment source for our services. We have 2 nurse practitioners. We see patients 4 days a week, and it's all cash check, HSA card, etc. And so we're really excited to do things the way that we're doing them. Check out our website, sscareclinic.com, or call the clinic for more information. Today we are highlighting our acute care services. So what that means is you're sick, you're hurt, you have something going on that's not chronic in nature or an ongoing issue. And we want to kind of just paint a picture for you what that experience will look and feel like at the Sensible Solutions Care Clinic. So when you walk into our clinic, which the entry is right here, we're sitting in the entryway. First of all, you'll be greeted with a smile because here at SSCC, we do everything with a smile. Most of the time, you will be escorted to a room before you even sit down. We really strive to have low or no wait times for appointments. Next, you will be roomed by our provider assistant, do everything chick, Brooke Shatley, and she will get a general history, update your chart, vital signs, etc. Then the nurse practitioner will come in, do a interview, get all the information that she needs. She'll do a exam specific to your problem, and then she might recommend testing if we need to do any sort of labs or imaging based on your concern that day. She will create a plan, prescribe any medications that you might need, and then decide what follow-up should look like. So that's the general process. And then when you're done with the nurse practitioner, she or the other staff will discharge you, get you out the front door with a plan and confidence in taking care of your problem. So Caitlin, would you please talk to us a little bit about, a little more specifically about urinary tract infections, vaginal yeast infections, and sexually transmitted infections?
Yes. So those are 3. So UTIs, STIs, and vaginal yeast infections are 3 acute care conditions that we see fairly frequently and we're able to treat really effectively in our setting. So Jamie had said that all of these things will require a physical examination, a history, but specific to urinary tract infections, often that includes getting a urine sample upon your entrance into the clinic. We are able to test your urine in the clinic right away to kind of know if there is an infection, and if so, we have many antibiotics in our pharmacy, or we can also send them elsewhere to a pharmacy of your choice. And then we are able to send your urine out for culture and further evaluation. And then yeast infections, sexually transmitted infections, if they do require a pelvic exam, we do have the ability and capability to do that in-house too. And then, of course, treating with medications either in-house or sending them elsewhere.
Amazing! Did you know we could do all that here? Ah! So you have urgent care needs. We have capability to take care of them. Brooke, would you talk to us a little bit about sore throat, ear pain, and rashes?
Yes, so we can see all of those things here in the clinic. It's kind of the same process that Caitlin was talking about. You come in, you meet with one of the nurse practitioners, we do a physical exam. We are able to do a strep test in-house here, so we do not have to send that out for culture. And what else? For ears, we can take a look at that if it's needed to flush out your ears, which I love doing. We're able to do that also. And then if you were ever to need a ointment or a cream for a rash, we are able to do that as well.
We are up to like 96 medications in our inventory that includes just to brush the surface, antibiotics, creams, ointments, inhalers, etc. So lastly, I'm going to talk to you about allergies, cough, and pain. So other acute care things, seasonal allergies or environmental allergies, if you think you have that going on, come on in. We can assess you for that in the same fashion. Same with cough, asthma exacerbations, COPD exacerbations. We can take care of all those things and pain-related stuff. So you sprain your ankle, you have knee pain, you deal with headaches, you have neck pain, orthopedic things. We can be a urgent care type setting for you to receive care for those needs as well. So that was a really brief overview of some of the things that we can do from an urgent care perspective. We just want you to know what your options are. We want to be a cost-effective and convenient option to receive care for acute care needs. If you're ever in doubt or have a question about whether we can see you here or not, just call the clinic, 715-637-0001, and we can answer all of your questions. Thank you for joining us for Coffee at the Clinic. And next time, I think we are going to go ahead and overview some of the procedures that we can do in the clinic. So stay tuned next month for that. Also, keep an eye on our website, our social media platforms. And if you're a member or have been seen here, you'll get email updates. We have a lot of exciting things coming, which I know I've already overviewed in the past, but stay tuned for some cool additions to Sensible Solutions Care Clinic. Have an awesome...
Wait, I want to say, provider is now in office on Tuesdays as well.
Oh, yeah. So, yeah, good. So we're seeing patients 4 days a week instead of 3. So growing and blooming 4 days a week. If you got something going on, we're happy to help you. Okay. Anything else?
Nope, I think that's it.
You guys good?
Yeah.
Good?
Good.
We're good.
Okay.
We'll see you at the clinic.
Bye.
Bye.